Hello, everyone. I just I'm going to deal today with an article. Not an article. I'm not dealing with the article itself. I'm going to deal with this concept. In Barbados about freeness and what's not. I'm going to deal with it in terms of the medical profession and healthcare, really and truly. Okay, so Barbados today has an article. It's dated June the 18th, 2016, and it is entitled "Too Much Freeness: Support for the Imposition of New Taxes on Healthcare." Already, to me, you're kind of starting wrong. All right, no, you're starting wrong. You are starting wrong. I can tell, but you know what? Unless you read the whole thing or whatever, they may not be starting wrong. So you give them the benefit of doubt. And by them, I mean the medical professionals in Barbados. Okay. Before I even read it, I just want to say, I really have a lot of respect for the medical professionals in Barbados. I look after my health like a human being. I go to the doctor. Some of us don't go to the doctor enough. Got to do something about that. You know what I mean? They studied long for a reason. They know what they're talking about for the most part, and you got to listen to your doctors, okay? But it's also your right not to listen to your doctor, by the way. Just saying, because something in the article was like, anyways, let me just read it, okay? So, two medical doctors and a hospital administrator are recommending that government should treat public health as a productive sector, apply user fees on careless people who fall sick, and impose a tax on fatty foods, not fat people, okay? Which undermine human health. I said not fat people because, there was this thing about a fat tax, a tax on fat people. But let's dispel the notion that that anyone is proposing a tax on fat people in Barbados, okay? Their proposals were put forward Wednesday night at a discussion sponsored by the Faculty of Medical Sciences of the Cave Hill campus of the University of the West Indies. Could have found a better way to do that sentence. Where non-communicable diseases, NCDs, came under the microscope. Okay, now let's already start. This is the wording more so, I guess, of the newspaper than it is of the news agency, more so than it is of the medical profession. But I'm thinking that they got general vibe from the meeting. Careless people who fall sick. People fall sick, okay? Some people do it, I guess, from carelessness. Men have a problem taking care of themselves in comparison to women in terms of, they take care of themselves less. Okay, men have a problem. So I've been told by medical professionals, by the way, that men have a problem actually rating how healthy they are. Okay, so, but you know what? If you want to come now and correct me, you come and correct me. Okay, good. Now, let's read on a bit more. Dr. Alifa Samuels, director of the Chronic Disease Research Center and feature presenter on the topic, Accelerating the NCD Agenda, pointed out that foods such as French fries, we all eat them, which increasingly were becoming part of the regular diet of some Barbadians should be taxed higher to make them less attractive as consumers. Family physician Dr. Colin Alert proposed that when people flout health advice, they should be made to pay their subsequent medical bills. Queen Elizabeth Hospital Chief Executive Officer Dr. Dexter James said healthcare should be treated like tourism. Now, let's get to this thing, okay? They should be made to pay their subsequent medical bills when they flout the health advice. First of all, if a person is told by the doctor to do X, Y, Z, and the person does X but not Y and Z, or the person does not do X, Y, and Z, that is that person's prerogative. No, I can understand that it's frustrating for the doctors, especially some of them genuinely care, and some of them, they just care about their egos. I can understand that it's frustrating for you. You have a patient coming back all the time. Oh, I didn't do what he said. I should have, and most likely they should have done what you said, or get a second opinion. But they should have done what you said. Okay, good. But you're saying they should be made to pay their subsequent medical bills. Fine. You know what should happen? They should get a discount on the tax because they're paying taxes for you to treat them. They're paying taxes to be treated multiple times. Every day they wake up to pay something in a tax, if it's a direct tax or an indirect tax, to be able to afford this free medical care that you are offering. Okay, that you are being paid to do. Nothing free about this at all. Everybody getting paid in this system and everybody paying. It is not an abuse of the system. This is human nature. What you're saying is that you're trying to force people to do what you say by coercive means. If people want to eat the French fries, they're going to eat the French fries. And let me just say, any proposal of a tax on fatty foods, I understand. We have a tax now on the sugary foods and what's not. Sugary drinks. I understand the need for a healthy country. I also understand a healthy people, but I also understand the need for freedom. And let us be very clear. Taxes are coercive. Taxes restrict freedom. And that is what you want. You want to be changing people's minds and changing people's choices. But we have to have a clear line between what the state is supposed to be doing and what the state is not supposed to be doing. This is why, right? When people talk about why people go to university to do philosophy degrees and why are people doing these social science degrees and humanities? Why are they not doing more science, engineering, STEM? Because you get binary ideas like this. These are binary ideas. These literally are binary ideas. What do you mean by a binary idea? Okay, in order to solve for X, we must get out the enigma. And we must make sure that people, if they're getting sick of fat foods, because we assume that is the case, well then we should make sure that there are no more fat foods to be had, or we should make sure that, we tax them into oblivion. And what I mean by that is tax the foods into oblivion. People operate in a wider society. The whole society is already being taxed. There's a tax on this, there's a tax on that. They want to put in a tax on waste. They want to put in a tax. We already have a general income tax that ranges from it ranges all the way to like 35%. Okay, at the highest level. Do you understand? That's a very high income tax to afford us these, and that income tax is a general tax to afford us the health care, to afford us the free education, to afford us security. Those three things, and we're paying extra taxes. In many cases, we're paying double taxes. No, double the taxes. And so, what's going to happen? People are going to have to what? Pay their income tax. Some waste disposal tax at some point is going to come for health and general environmental issues, because really truly health and environment are together. It's separate ministries. I want to do a video on government ministries and how airy-fairy they are in the Caribbean, to be honest. 1 minute you have the Ministry of Social Work, next minute you have the ministry. You have one ministry, it might be social work and something empowerment. And then in another ministry, you got youth empowerment. Because you can't have elderly empowerment with youth empowerment, apparently. So you put youth empowerment in the Ministry of Culture, but it's something to do with elderly care in the Ministry of Social Work. Really? Ministry of Social Work? I mean, we need to start thinking about our ministries, but that's another issue. I think I might do that with the St. Lucia government, the recent one, because everything is something about economic empowerment. What one? Economic empowerment. The next one is economic growth. Anywho, so back onto the issue. You gotta take your time. We have a problem. I know people dropping down right now in Barbados. Every day for a little while now, you've had something about somebody dropping down, or multiple days you've had somebody dropping down. And this is something that happens in Barbados periodically. I think this happened last year and the year before. People drop down at a certain point in time. Things happen in threes too. Somebody dead, somebody else will die, somebody else will die. That may sound callous, but I'm not trying to be callous. I'm just being very real about it. No. I might die, you might die, somebody else might die. I keep putting myself in these examples, don't I? No. Let's talk now about what we can do as a country to really help ourselves out. First of all, I commend the University of the West Indies, Cave Hill campus, Faculty of Medical Sciences, for getting these discussions out, trying to engage some part of the public, getting the medical community, which has been very reclusive, to come out and speak on issues. I would like if we could have a more holistic, I know people say this all the time, but I want a more holistic approach to this, to anything that we're going through. For most things, some things you can actually have a binary approach, but for this, we are a society still on a very colonial diet, eating many fatty things, blah, 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 but it's a cultural thing, and I don't think it should really go away. I think we should try to create a Caribbean diet that is made for our culture but can sustain us. Barbados, people dropping down, but we still have we're still the country with the second highest number of centenarians per capita in the world. We're the one after Japan. Everybody's like, Japan, Japan, Japan. Barbados is diabetes central. Yet something going on up in here that makes us so good at staying alive. So, why is it that my great uncle was smoking and drinking all the way up to 101 or 102? Still alive. Good. Well, he's not alive now, he died. But still, he was 102 or 101. The point is that I'm not advocating for smoking and drinking, by the way. But the point is that we need to find ways of resolving issues in our country without blaming the people. And this condescension, is a lot of condescension that's going on. This condescension about people and basically they're saying it's their fault. You have this situation here. I want to read another part of it. Where is it? In our system. So Dr. Alert said that cutting healthcare costs was a challenge to behavior. Okay. In our quote, in our system, the free universal healthcare system, we implore people that their health is their responsibility. Agreed. But yet, if somebody drinks, smokes, eats badly, and gets sick, they are offered free healthcare because they're paid for it. Sorry. But yet, if somebody drinks, smokes, eats badly, and gets sick, they are offered free healthcare, free medication, free hospital care, he stated. So, end quote. Quote again. So, how can you discourage them from doing unhealthy things if a virtue of their bad behavior they then get lots of freeness? End quote. Because they're paid for it. Let me say it. They pay the taxes that put you there to be able to treat them. They pay the taxes, they pay the medical bills in the taxes. Okay? It is not our fault that the government has, in other areas, may have misadministered funds, or what I mean by that is that they have not thought about how the whole system works. So now the healthcare system is under severe pressure to be able to employ doctors. And let's get something real right now. People want more money, right? Doctors want more money. I know y'all want more money. You think this is really like a poll tax. You think by putting a poll tax, first past the poll, so you come to the polls, you come to the hospital to get money, and you think to get treatment, and you think, oh, you have to pay your money now. It's going to get people in Barbados to what? Pay? No, they just won't go. You're going to create a situation where people just won't go to the doctor at all. That's what you're going to do. But I don't think that's what you want. And it's not a lot of freeness. The same thing with the education debate. It's not a lot of freeness. People may abuse the system, but it's not a lot of freeness. People are enjoying the few luxuries they have in life, which they paid for with their labor to be able to afford to go to a hospital, which they can call a free medical service. But in reality, is their labor paid for time, present, past, and future, with their offspring to be able to afford them quality health care, which you as the public servants and the servants of the people in general in private practice are to afford them. For they pay you, whether they go to the hospital and have paid through taxes, or they go to you and they pay you. A tax on health care means a reduction in all sorts of different taxes, people, because I am not, and I'm gonna tell you right now, I'm gonna have a paper. I'm not an advocate for certain things, certain types of taxes. And a tax on healthcare is a regressive stance. It is an oppressive stance, it's coercive, and it will not work in this way. Not for these reasons, for sure. For sure. Okay. Something has to be done. And at some point, I might give myself a lot of time to really start thinking about what could really be done. I just want people to remember that we serve people, we serve each other. We have to show each other respect, and I am not seeing a lot of respect for people in these comments. I understand that doctors may be frustrated, but this is not the way to go about it. This will not garner any sympathy. Go on Barbados today, read the article, and let me know what you think. Remember to like, share, subscribe, and enjoy your day. Bye-bye.